This is Joe McHugh with LibertyStrikesBack.com, and today we are covering the Democratic debates, especially Medicare for All and versus the alternative. Senators Sanders and Warren supported. Vice President Biden would like to expand the Affordable Care Act. You have to credit Senator Sanders for driving the narrative on this $32 trillion Medicare for All program. He says it's actually kind of a bargain. Elizabeth Warren also supports Medicare for All, although she won't talk about how much it's going to cost because she knows it's going to cost an arm and a leg. Now, she is proposing a wealth tax, 2% levy on $50 million, and a higher tax for billionaires. And now the wealth tax is not really worked out in Europe. There are 4 countries that still have it out of 12, and these are the 4 that still have it. There were 12 that had it before. Some people are saying that it's not working out very well because countries have had a hard time collecting the tax money. I would assume that that's probably partly true. Generally, wealthy people have the means to move their money around and avoid taxes. Also, though, when corporations tend to control the narrative and own governments, it's difficult to be able to tell if it's actually true or not that a wealth tax would work. Either way, I don't believe that a wealth tax is the most effective way to drive down the cost of care in America. And we'll get into that in another video in which I present to you my alternative and what we ought to be doing to drive down the cost of care while also providing health care for all Americans and improving the health and wellness of everybody in America. Now, with that being said, since that's not on the agenda as of right now, and Medicare for All is, then let's talk about who supports what. Andrew Yang joins the 2 senators in Medicare for All. We've got Booker, Castro, and Gabbard supporting Medicare for All with a Medicare for Some option. And then we have the rest of the field, effectively Vice President Biden, again with Affordable Care Act, Pete Buttigieg, Kamala Harris, Amy Klobuchar, Beto O'Rourke, and Tom Steyer are looking at expanding coverage but opposing Medicare for All. Now, go to factcheck.org. Again, Bernie Sanders is saying that it's $32 trillion. In this video, he thanks the Koch brothers for explaining to the American people that the going Medicare for All actually saves the American people $2 trillion. But what he's not telling you is that the study that he's referencing, which is this one right here, is showing that the cost is actually double what Bernie is quoting at $60 trillion, not $32 trillion, and that the $2 trillion savings is to drop it down to 58, which is still $26 trillion more, 85% more than Bernie's quoted figure of $32 trillion. To put that in comparison, $30 trillion, in the best case scenario, $30 trillion over 10 years means that it's $3 trillion of tax revenue or $3 trillion added to the deficit, in which case we either have to double the taxes or blow up the dollar. Neither of those is a good idea. Now, bottom line is we do deserve better health care, and that is the reason why the UAW went on strike with General Motors. Now, take note that the UAW went on strike for better health care to negotiate with General Motors for better health care. They did not just put all of the members of the UAW on Medicare. Now, if Medicare were better than what they could get through GM, then they would have simply just gone on Medicare. The fact of the matter is, private sector and people do a better job of negotiating for health care, a better job of negotiating for anything than the government can ever do. So we'll get into, so you can kind of tell where I'm coming from. I do believe we ought to have health care for all, and that the private sector would do a better job of negotiating, and we'll get into some of the drivers of that. Okay, so this is according to Hospital CFO report. The drivers of care are physician and drug costs. Drug costs in particular, I think, is something of note. We have uncoordinated care, expensive technologies and procedures, uncoordinated and fragmented care. Imagine your football team not having a quarterback or an offensive coordinator to call the plays. It would be a total disaster. That's you have to have coordination in care. Lack of cost consideration from the patients as well. When was the last time you went to an auto dealership and you said, well, you can get this Ford Fiesta. Ford Fiesta is great. But compared to a Ferrari, you're probably going to opt for the Ferrari in most situations. Now, if everything were socialized and we just had the insurance companies pay for cars, then you could just walk into the dealership and say that I'd like a Ferrari, and then they would say, okay, sure, I'll send the bill to the insurance companies. It doesn't work like that because that doesn't work. And so healthcare is the same way. Again, I believe that there is a better way to provide healthcare and wellness for the American people across the board, and we can do it without Medicare for all. I think in particular, we need to address the unhealthy behaviors, the lack of cost consideration from the patients, and the fact that we have expensive technologies and high drug costs. And if we do that, we and you look at it from the perspective of corporate America, they look at healthcare as a cost center relative to productivity loss. And so let's look at corporate America. Corporate America, you've got $2 trillion per quarter of earnings, which is pretty steady. Dating back to 2012, we've got roughly $8 trillion per year of profits. So just a quick overview. If you were to put corporations, peg corporations, divide and conquer, and force corporations to pay for this, not a wealth tax, but a tax on corporations to pay for healthcare for everyone in America, you would see that corporations would do a better job of negotiating with the drug companies to drive down the profit margins of the drug companies, because this would be a tax on all corporations, and they're going to want to improve their bottom line at the expense of the drug companies. Divide and conquer is a much better strategy, and I will get into exactly how I propose to provide healthcare coverage for everyone in America while driving down the costs and including private participation, so that everybody in America can know what there's good transparency in healthcare. I'll explain that in another video. If you thought this video was informative, remember to like and subscribe and come back for more videos at libertystrikesback.com. Thank you very much, and I look forward to providing you with the next video about how to drive down the cost of healthcare while providing healthcare for everybody and improving the health and wellness of everybody in America in the process. Thanks.